Welcome to United We Spay, the show dedicated to promoting affordable spay-neuter services nationwide. Each episode delves into the heart of the movement, sharing inspiring stories and driving positive change. Our goal is to raise awareness, educate, and empower, addressing overpopulation's root causes to ensure every animal has a chance for a better life. Hosted by Stacy Loren and the United Spay Alliance team, we're on a mission to change lives. Fed up with the fixation on symptoms in the animal welfare conversation, it's time to change the narrative. Join us on United We Spay, where we make a difference by spreading knowledge and building a compassionate world for animals. Let's put prevention first and spotlight spay-neuter in the animal welfare space.
You're listening to United We Spay, a podcast from the United Spay Alliance. United Spay Alliance works to promote accessible, affordable, and timely spay-neuter services because an ounce of prevention today can prevent untold suffering tomorrow. Spay-neuter, it's public health for pets. I'm Stacy Loren, United Spay Alliance board member and host of the show. And today on United We Spay, we are speaking with Loren Breen, who is the Director of Policy, Research, and Government Affairs at the Animal Policy Group. Loren works to develop policy strategies and build strong coalitions to expand veterinary access and advocate for animal welfare. She conducts in-depth research on a state-by-state legislative and regulatory initiatives and tracks, analyzes, and reports national trends. As the Director of Government Relations, she advocates on imperative issues to advance the veterinary industry. Loren has a Master of Public Policy degree. She interned at the Arizona House of Representatives as a research analyst for the Committee on Regulatory Affairs and the Committee on State and International Affairs and taught Introduction to Statistics for the Social Sciences at the University of Arizona. Loren, I'd like to welcome you to the show.
Thanks, Stacy.
All right. So we're going to talk all things legislation and spay, neuter, and other fun stuff today. But before we jump into that, why are you so passionate about spaying and neutering?
So I've had a lot of cats through my life when I was a kid, a teen, an adult, and all of them have been shelter cats or trap and release stray cats. But I think the thing that really got me involved is joining the United Spay Alliance Veterinary Shortage Task Force. So meeting about twice a month and getting to hear veterinary input on how we can solve this problem.
Excellent. Excellent. That committee has turned into a dynamic and very energetic group. We do meet on a regular basis. The information that you have provided to that group has been just invaluable. It's been really great because you have this national picture of sort of what's going on all over the country. So with that being said, you have an eye on the legislation. What are the things that are happening nationally around the country with regards to spay-neuter?
Okay, so I want to start off by saying I joined APG in 2020, and the current tracking system they're using for legislation in all 50 states started in 2017, and they were tracking about 100 bills. And this past session, we tracked over 2,300. And we've definitely expanded our scope. So adding things like shelters, spay and neuter, but also those core issues that we look at are seeing so much more action every year. So I do want to get into the big trends in the legislative pet space, especially related to veterinary shortages. But starting with the shelter, spay and neuter bills, I like to think about the spay and neuter bills in categories. So starting off, we have prohibitive bills, and these will do things like prohibit a facility from releasing a dog or cat that hasn't been sterilized. We saw this introduced in Mississippi, but it didn't pass. But with these prohibitive bills, the language doesn't include any sort of monetary substance from the government. So it's essentially telling a shelter to do something, but there's no assistance, nothing to fund them spay and neutering or to hold on to these animals longer. Then we do have the government or tax initiatives, and we saw 2 or 3 of these pass this year. So some bills like passed in California allow individuals to designate tax returns to shelters. In California specifically, it was for euthanasia prevention. Louisiana passed a pet stamp program, so that raises money directly for spay and neuter services. A couple we saw introduced but failed. Hawaii had a bill that would have allowed people to designate $5 of their tax income. That bill also would have appropriated $50,000 from the government for the next 2 years. In Alabama, they introduced taxes on dog and cat sales to fund animal control officer training, shelters, spay and neuter. Virginia also introduced a sterilization reimbursement program, and that came from a pet food surcharge on manufacturers. Maryland introduced the same thing for commercial pet food. A non-tax bill we saw out of Tennessee would increase the minimum, the amount of the agency can accept for new owners adopting pets that haven't been spayed or neutered. So currently they can accept as low as $25, and this bill would have raised that to $45. That fee can be returned to the owner upon spay and neuter. So they're just trying to motivate these people who adopt pets to spay and neuter them. And then South Dakota lastly passed a bill that would allow people to temporarily take responsibility for feral cats for spay and neuter. So the reason for the change in that law is so when they do a trap and release program, the person can't get in trouble for abandoning if they're just trying to get the cat released or spayed and neutered before release.
Wow, there is a lot going on, a lot to monitor. So of these proposed bills, though, many of them are not going anywhere, not passing. So what can we do in order to try and move them forward, or should they be moved forward? I know sometimes bills are more hurtful than helpful.
Right. So that trend is what we see in a lot of places. The shelter bills, for instance, we saw 60 introductions this year, about 20 passed, but only 4 of them allocated money. I think the best thing that veterinarians can do is reach out to their legislators. So when they see something come up in committee, they can write a letter. If they're nearby, they can go and offer public comment during the public comment session. But I'm not a veterinarian. I work in the veterinary space and I advocate on these bills. It's my job. But I think having a veterinarian who has that hands-on experience weigh in is a lot more impactful to veterinary boards or the legislators.
So in your job, are you in touch with the state veterinary medical associations and working with them to see if they are supportive or not supportive of these bills?
Less than we are the boards or the legislators. We do reach out to VMAs when there's issues that we know that are on their radar and we want to work together. So we saw a lot of xylazine bills this session introduced, and we know that that's also a big issue for them. So anywhere that we know they're working with legislators, we reach out to make sure we're on the same page so that we're not reaching out separately and asking for separate things.
You touched upon the shelter funding bills. Can you more clearly define what that means? Is that just saying I need $5 million for my municipal program, or is it more of funding shelters, across a region? How are these funding bills put together?
So it is regional. The few we saw pass this session, we saw $25,000 for all municipalities and counties in Arkansas. And then we saw $4,500,000 to San Bernardino, California. And that was for a new shelter facility. So it ranges a lot. Obviously, the larger populations will see more money. But like I said, only a few of those that passed allocated money. The majority of what we see is resolutions, bills commending people who promote spay and neuter, or bills assigning a board to start a committee on shortage. So we don't see too much action where those funds are actually getting distributed to shelters.
So how is the legislative community addressing the vet shortage situation that we're faced with?
So I think a couple of the biggest trends, I would start with veterinary technicians. So we know there's this vet shortage, and this means we don't have enough hands to perform the spay-neuter services, especially in shelters. And we can't just magically create more veterinarians. So how can we utilize what we already have? And this year we saw about 30 bills related to vet techs and mid-level professionals. That's tripled in the last couple of years. And vet tech licensing is a bit of a patchwork. So we have licensed vet techs, registered vet techs, certified vet techs. So we did only see one licensing bill pass out of Minnesota. And a few states passed scope bills. So these outline basic duties and supervision requirements for veterinary technicians. One that was really notable is this session, California introduced a bill that would authorize an RVT to perform neuter surgery under direct supervision. So that direct supervision means the DVM is on site and easily available, but they don't need to be in the room. This bill's been parked in committee since May. But what we tend to see with these bills that make a splash is maybe one is introduced, the next session, a few more introduced. And if the idea catches on and it's successful in its adoption, more and more states will start to adopt. So this one in particular, I'm interested to see if it goes anywhere. And also out of California last year, they passed the bill that allows RVTs to act as an agent of their supervising vet. So they were able to establish the VCPR for purposes of administering preventative or prophylactic vaccines or medications for parasites. So this essentially let the RVT establish care. And this is another one that I'm curious to see if it'll take off because it involves telemedicine, but also expanding what a veterinary technician can do. And then lastly, we did see Florida introduce mid-level professional bills. So this is creating an entirely different level of practitioner, and they would require a master's program. These didn't pass, but currently in Colorado, there is a ballot initiative. And I think this will determine the fate of the veterinary PA, at least in the short term. If it passes, we're likely to see a wave. And if it fails in a state like Colorado that's liberal, I think it'll be dead for a little bit. Either way, I think it's going to spur legislation. The opposition to this VPA position wants to build vet techs up. So I think they're going to need to introduce legislation that says, we want to license you, we want to give you title protection, we want to establish what you can do in scope.
So if you think that the VPA position may not be that successful, but then maybe the RVT proposal of allowing them to do neuters, that might have a stronger chance as a compromise?
That's what I'd like to see. If there's not a mid-level professional, I mean, either way, I want to see vet techs be utilized to their full potential. But I do think that this will spur the associations to start proposing legislation for their vets and vet techs.
So when you're doing your research and when you're monitoring things, how are you getting this information? And would you recommend individual clinics in each state to actually keep an eye on these items?
So we use software and we set up query systems. So we have key terms we're looking for. We sift through the bills. And like I said, we track 2,000, but I think we go over about 8,000 bills at the beginning and throughout session to see what we really care about. Most state websites do allow you to sign up for notifications. Some of them are term specific. Some of them you can follow a committee where you expect veterinary bills to go. But a lot of states do have that resource if people want to follow along in their state. I think looking to the state VMAs in some of the states is a good idea because they will have a legislative watch section to their website.
What have been the most successful types of legislation that you've seen?
As far as addressing the shortage, I think it's one of the more controversial topics, which is telemedicine. And there's definitely two sides of this camp. People who are on the side that supports the use of telemedicine for in-person exams, they stress the need for access to care and a vet's ability to use their professional judgment. And then the other side opposes telehealth as that initial point of contact, and they stress the need for that in-person exam to initiate care. We did see a couple states pass a telemedicine bill recently that allows the vet to establish that care through VCPR. In California and Florida this session, it was unanimous. Out of Arizona, it was almost unanimous. But we saw it fail in Colorado. And I think this is another one of those topics where we're going to see a couple states come online each year. And then maybe after a couple of years, more states will. But I think as far as big issues that are making a ripple, this is one of the ones we see with a big impact. And we also have Michigan, Ohio, and New Jersey all have pending telemedicine bills, but I don't expect they'll see movement this year.
Interesting. Well, I mean, it's good to see that there's some states that are moving with regards to that. And I'm not sure if there's a relationship between the states where that has passed and those states have a higher percentage of position vacancies or that. Do you have an idea, like across the country, what states are most challenged by the staffing shortage that we're faced with?
I don't off the top of my head, but one resource I can provide to you, there's a veterinary coalition for addressing shortages, and they've created a really incredible map, and it's down to the county about how many vets there are per 1,000 households and where our greatest shortage needs are. And I think your question's really good, and it would be nice to look at that correlation because this is happening in very different states. California is obviously one we see who are trying to be progressive in their use of vet techs, their allocation of funds. But I think it's probably a really different story in Florida and Arizona.
And also, rural areas of the country are being significantly impacted. If you had one veterinarian and they retired or they quit and they couldn't sell their practice, and now you have to drive 60, 90 miles to get to a veterinarian, I can see a strong role for telemedicine there.
Oh, yeah. For rural areas, for people with limited mobility, or people, with 2 people in the house working full time, it's hard to get to a vet clinic. Or even personally, I was on vacation. We had a cat sitter. I came home Friday night. It was apparent my cat had a UTI, and I was able to get on the phone at 7 a.m. with telemedicine and get a prescription the next morning versus waiting the whole weekend to see my vet. And I think there's little things like that that are really helpful where you don't want your pet to suffer for 3 days.
Right. And then the veterinarians in the practice are able to deal with the surgeries and continue to establish and have clients and do wellness visits and that kind of thing. But there is definitely a role there for telemedicine. In your work with Animal Policy Group, specifically, what are the goals of your organization?
So the first goal that I'm directly related to is we meet with veterinary groups, similar to the Shortage Coalition Task Force, but also to inform them of this legislation. So it can get really in the weeds. We meet on a weekly basis. We say, this is what's happening. And then they can give us feedback and say, it's really hard for us to implement that on the veterinary side. Can you reach out? And a lot of times we reach out to a legislator and it's just something they hadn't thought about. It's not often like an issue fight that we have to have. They just hadn't consulted a veterinarian or thought about how it would impact a veterinarian because it wasn't intended for that. Additionally, we do work to bring veterinarians and shelters together when we can. We just recently hired Katie Jarl. I don't know if you're familiar with her. She's joined a couple of our calls, but she comes from the Humane Society world and the animal welfare shelters. And so she's been really key in helping us drive these coalitions and see how we can get more funds to these shelters. Another big issue, a few we're working on, is reciprocity. And that is board related for now. Legislative initiatives take more money. So we're waiting on that. And pet housing is the newest one this year. So trying to create access to housing for people with pets or removing those barriers.
Let's talk a little bit about reciprocity. What is that? And what are you looking for in that?
Great question. So actually, we should move away from the term reciprocity, as I found out talking from boards. So we like to call it reducing or removing prior service requirement. So there's 17 states that allow you to move from another state and start practicing as a licensed vet tech with an active license without retaking the NAVLE. The rest of the states, if you haven't been practicing continuously anywhere from 1 to 10 years, you're going to have to retake the NAVLE. So even though 1 year doesn't feel that onerous, there's states where you need to be practicing immediately 1 year prior to moving. If you've taken time off for maternity leave or illness or any personal issue, this can really set you back, even if it's just the 1 year, especially those states where it's 5 years or 10 years. And we do get initial pushback because states who have these rules or laws in place, it's for a reason and they want to protect their citizens. They want to make sure their vets are up to date. But our argument is if that vet is current with their CE and they have their active license, they have this knowledge to practice. And it's the same, if not better than a recent graduate, like they have all this experience. And ideally, they can help address these shortages and continue practicing when they move somewhere else.
I mean, at this point in time, I think we should be doing everything in our power to encourage our veterinarians to stay working. And we all are moving all over the country. And so it seems like we should be able to transfer our licenses from one state to the other. It's a much smaller world, I guess, than we used to be. Going from Massachusetts to California is not that strange of a move these days.
Yeah, I feel like especially since COVID, there's been so much more movement. And we also looked into other industries, and there's this licensure by endorsement in these other industries also. And what we are seeing more and more is states introduce an overarching reciprocity or an endorsement bill for all of their professions. So it won't be specific to one board or one industry. They'll just say, if you move to Arizona, come on and get your license.
Do you get a sense that there are many veterinarians that are getting sort of moved out of the industry because of some of these barriers?
That's a good question. I think it definitely varies by state. I think some states we've talked to say they haven't really had an issue with processing those times. But I know we've also talked to veterinarians who have found it almost impossible to move to another state, especially if they want to start practicing quickly.
Mm-hmm. Let's talk about pet housing. You said that's a new area that you are covering as an organization. Where is spay-neuter in the pet housing world?
That's a great question. I think it's just tangentially related. I mean, removing the housing barriers means we're trying to reduce or remove pet rent, pet security deposits, or breed restrictions. And I think that just encourages people to get or keep their pets. So it helps shelters when people aren't returning pets or getting rid of them due to housing restrictions. And anytime we can alleviate shelters, we're, increasing access to spay and neuter.
Right. Well, and obviously, spayed or neutered animal is most likely going to cause less damage on the housing, and behaviorally will be a much happier animal to live with. And so it just makes sense that we should ensure that families that are in a position, it's a risky environment. If it's a risky environment, we make sure that they're spayed and neutered so that they're not at risk of being surrendered.
Yeah, that's a great point.
So, Loren, if folks had like one takeaway from our conversation today, what would that be?
So we did touch on it a little bit earlier, but I think the greatest thing is getting veterinary involvement with advocacy. So even one person speaking to their vet board expressing concern over an issue or one letter to a legislator can make a really big difference. And I think that you brought up a good point asking where people can find these resources. Anyone who also wants to be part of this, our vet shortage task force, we can provide those resources through APG as well.
Excellent. Yeah. So if folks are interested in finding out more about the Animal Policy Group, how would they do that?
Animalpolicygroup.com. And then I, as well as my teammates and Animal Policy Group itself, are all on LinkedIn.
Anything else that you'd like to share with our listeners today?
I guess one more thing we didn't touch on was veterinary loan repayment. So this was new to us in 2022, and we do see a large volume. But again, it's a lot of study groups, and most of the bills we see are directly related to rural veterinary repayments, which is great because these are high shortage areas. But I think for these types of bills to make a big impact on the shortage, they're going to need to start introducing and passing loan repayment for all types of veterinarians.
I don't think people think about it that much as an option or market it. So great that you brought that up. Loren, I'd like to thank you so much for joining us today. And thank you all for listening. If you liked this episode, be sure to share and subscribe. We'll be releasing a new episode each month, digging into important conversations surrounding spay-neuter throughout the U.S. and around the world. For more resources for spay-neuter and to learn more about our work, go to unitedspayalliance.org. That's United, S-P-A-Y, alliance.org. Feel free to get in touch with United Spay Alliance at any time by emailing info@unitedspayalliance.org. Until next time, thank you.
Thank you.